My name is Alexander Alvarez, and today I will be instructing the use of diagnostic ultrasound for assessing the acromioclavicular joint. I will be going over the AC joint anatomy, the patient positioning, and the diagnostic ultrasound evaluation process for the AC joint. The AC joint is formed by the junction of the lateral clavicle and the acromion process of the scapula. The AC joint attaches the scapula to the clavicle and serves as the main articulation that suspends the upper extremity from the trunk. The ligaments that stabilize the AC joint are the acromioclavicular ligament and the coracoclavicular ligaments, which are comprised of the conoid ligament and the trapezoid ligament. The muscle that passes through this joint is the supraspinatus, and the subdelta bursa can also be found in this region. Here we have a coronal view of the AC joint on the diagnostic ultrasound. We can see the acromion process to the left and the clavicle to the right. In between these two bones, you can see a difference in echogenicity, meaning that this is the AC joint space. Patient position and diagnostic ultrasound evaluation. First, you have the patient sitting upright. The clinician will then palpate to find the location of the AC joint on the patient. On this particular patient, the AC joint was located anteriorly. The clinician will then apply ultrasound gauze medium for the diagnostic ultrasound and ensure that the notch of the diagnostic ultrasound is facing towards the patient. The clinician will then place the ultrasound unit on the patient and begin their assessment. The clinician will want to recognize normal smooth margins of both the clavicle and the acromion. You want to see uniform thickness and uniform echogenicity dorsal to the AC joint capsule. You want to make sure to sweep the probe posteriorly and anteriorly when doing so. The cross-shoulder adduction test, also known as the scarf test, will be used to assess the AC joint. The clinician will want to observe for any asymmetric widening, narrowing, or offset, which can imply some instability of the AC joint.